बोलिए
सर, फिर से बताइए। अभी स्टार्ट किया रेडियो
हाँ
रिकॉर्डिंग।
मैं एक स्लीप डिस्क के पेशेंट को ट्रीटमेंट कर रहा हूँ।
बैक कैम, फ्रंट कैम।
मैं ये श्याम लग चुका हमारा। श्याम का प्रोसीजर कल तक परसों तक आपको दिखाएंगे। हाँ, ये स्लिप डिस्क का पेशेंट है। L4, L5, L5, S1 में extruded disc है. He's saying now he's having 64% relief and 35 to 40% pain. Wherein one procedure, his pain should be relieved by 40%, whatever he is having. And I'm going to use my epidural injection.
ट्राई कॉर्डल सर, कॉर्डल ट्राई करेंगे।
कॉर्डल तो आपने दे दिया, आप थोड़ा मेरा भी देख लो। कोड़ा तो कर ही दिया था, अब मेरा कोड़ा भी देख लो।
ऐसे 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 सो जाइए, ऐसे बस उल्टा सो जाएंगे, उल्टा सो जाओ, पेट में सो जाओ। नहीं
So here you see, this is, now find me where is L4. First sanitize my hand with betadine.
1 minute, this is L4, L3,
How,
L4.
sir?
How do you do it?
I like crust, na? It's always L4.
So from L4,
हाँ,
first of all, whenever you work without gloves, sanitize your hands with
betadine.
betadine. Then, this is the first sanitizing level. Then comes with the spirit. Then comes with the hand sanitizer. I think my hands are now completely sanitized. ऐसे ग्लोव्स खरीदे तो पता नहीं कितने ग्लोव्स हो जाएंगे दिन भर में. So now you see, is having extrusion at L4. This is electrist. This is L4 location, right? Go one finger above.
One finger above.
Finger above. L3 is 4, right? Is mainly having pain at L2, L3. Yeah, quadriceps. यहाँ दर्द है ना? अभी दर्द कहाँ है? बनाना 35% पेन है, कहाँ है? Since you start that area, again sanitize. So it's near S1. That is L5, L4, L5. I go S1. You can go like this also, but then I like to go this. So this is my own developed stem cells. You may look, seems like PRP, but I've combined it with various things.
Your papa,
Somewhere, no papa.
mommy.
Somewhere, mommy also not there.
What is it?
Only. Proper stem cells. And after giving, you will get immediate results. So, how to give? See, giving technique of stem cells without anesthesia is also a very good enjoyment. Go inside, go to neurosphomenia, near the cord, near the cord. Come on. out, out, go left, go right, go up. मैंने आपको बोला था ना, पापा सोच के बारे में कभी नहीं बताएंगे. इसे मोस्ट ब्यूटीफुल जगह है. नहीं बताया.
He was telling me something about he's using mixture of fentanyl and what else.
और सब कुछ बता देंगे, सोल नहीं बताएंगे. सोल इज ए मैजिकल ड्रग. मैंने बोला था ना, 25,000 बार मैंने पूछा. आप खाली उनको एक ही तरीके से कर सकते हो. आप उनको स्टेम सेल के बारे में प्रैक्टिकली सिखा दो, फिर वो मुश्किल से आपको बातें बातों में पूछ लो, वो क्लिप ऑफ टंग में बताएंगे.
Oh, I asked him. So what he's saying? It is to be done in an institute, OT. That is why I'm not doing and telling anybody.
Then
That's all
why,
they-
then why are we doing here? How many
He's
times
doing
I've
it
done?
over here.
How many times I've done
Huh?
with Sol? How many times Sol I've used?
What?
Soul language.
How many times we have used? यार 50,000 बार लगा चुके हैं सोल.
क्या बोल रहे हैं?
अरे क्या?
तो फिर आपको मालूम होना चाहिए ना सर क्या है उसमें.
अरे इन लोगों को पूछ लो.
इनको भी मालूम है सब लोग.
डॉक्टर मोहन सिंह का हिस्ट्री है.
हाँ.
वो जब अरब में देते थे 6 घंटा का सर्जरी, हिप रिप्लेसमेंट, कॉम्प्लिकेटेड मल्टीपल फ्रैक्चर, वो लोकल एनेस्थीसिया में करते थे.
बाप रे.
He knows cocktail. He's the only doctor I came to know who practices cocktail of practice.
He was telling me he's doing acupuncture, he's doing herbal
No,
medicine.
no.
Huh.
Cocktail of anesthetic drug.
Yes.
This is again an S2, sir.
I'm going where? Near the L3.
Exactly.
Because it will be here.
I can't.
You won't feel because it is in the depth.
Ah.
You have to feel the needle from here.
Mhm.
Where are you inside? Are you harming the dura? Are you harming the cord? You have to feel it from the tip of this. And never try to feel from the tip. Always try to feel from ear to ear. This is insensitive. Will give you what? Wrong information. Tabibi, when you do any type of such procedures, never use this. Always touch from this to this.
Yes.
I never use like this. I always go like this. This is much sensitive. This is the most sensitive area. So, where is the check the pen.
कैसा भी पेन. हाँ. I have to fix this up.
No, it's zoom glass.
हाँ.
No LA was used. No local anesthesia. Zoom. पेन कितना है? अभी जो दिया उसके बाद दर्द कितना है? How much? Tightness, stiffness.
Stiffness is a little bit.
Where is the stiffness? Sit down. Why should you go out from the clinic with that stiffness also? see my patient. My health is not good. Still, I want that after my death. There is even 2% of this knowledge is people. How many years can you say? I will check your sickness is not there.
This side gone.
Check which side is gone and which side is there. You catch them. Which side it was? Now this side is there or not?
This side is there. No.
Where is the stiffness? Check.
There's no stiffness.
Walk and see.
Yeah.
Where? Which one? Back one. Show me. Keep me. यानी कौन सा मसल? Medius, correct. Now, static nerve. Root level. S1, S2. Go like this. S1, S2 comes here. So they madam,
Yes, sir. Only.
you. लड़कों को दो. आपका काम नहीं है मंदिर करना. लड़कों का काम. Now check. S1, S2. थोड़ा सी अभी कितना है चेक करो. This is 60% extruded.
Yes, it's
Slightly bypass.
Huh?
It's like side.
It's just like
no, this side.
Injection pain.
All your pains away. So go only at this point.
Yes.
Okay, what about this tightness?
It is little bit.
not that much. So you want to remove his tightness of the hip, right? I'll remove it in 1 second without doing any stretching. Very simple technique of biokinetics. Inclusion of bio and kinetics. Just study the hippocampus, right? And the motor cortex, and you will find how to revive patient. Reviving patient is just a fun. Any patient you can take, it's just a fun. You don't see me fun. I treat almost 100 patients. After midnight, I'll give you lecture and I'll teach you by tomorrow how you'll become an expert of brain stimulation. You keep asking me question and I'll keep answering you. Ask me the most difficult question and I'll give you the most easiest one. Let my exam be taken fully. Whether I'm a physician or I'm not a physician. You are fully free, you have full freedom to ask me all questions. It's a very typical compression of the nerve root over this point. I'm getting this only by my own
A point. This point.
I am going to बता रहा हूँ लाओ लंबा निकल दो सुलाओ
One more thing.
now long sleep परगनी बाबू बाबू पापा लेके आओ बच्चों these people will go there from Gujarat. I don't know what they understand. Sandy, कब सोचेंगे? आप सोचेंगे रंडी, हमारे यहाँ बहुत अच्छी है। इधर आइए और बैठिए। वेब वॉरंटी बहुत ही पास में लगी है। इसको मैं ये रिस्पेक्टेड वर्ड है। रंडी मतलब सब लोग कहना ये नो रिस्पेक्टफुली भी से
So इनको realize नहीं किया तो like
काम कर रहे हैं Which come on. See, now the number. Check. Check.
Down, down. No pain.
How it goes clinically whether you have pen or not. First you don't walk and see. How much pain?
0%.
Huh? Now you understood. When you go to work, you must know all the weapons. This did not work. This still this is left. And when he goes from a clinic, it should be what? 0%.
I gave you almost like this.
How did you come?
I become a wedding.
So
Almost like this. Unable to walk. Keep on Is that within 5 minutes? 5 minutes and stopping from the phone. I think
say loudly. Others say,
I said here. He said that some injections are other things. I don't know.
Papa 1, Papa 2.
Whatever it is. Ready? It's my problem. That is max at 5 to 7 minutes. It took 5 to 7 minutes.
And all the news and advice you immediately.
I thought of one of the greatest doctors in Hyderabad. He asked me to operate. And I have to sleep on bed for 3 months. Then I came to know through one of my friends. Came to know him. Then I came here. A great night. I know him.
He came to me at night 12 o'clock.
But my pain and fear. Almost I treatment for the last 7 years I have seen. The suffering of 100%. Now almost reduced to 70%. Probably he gave me the 15 sittings. 7 hours. So
How
you
do
can-
सर आप पूरी नवीन कैसे करते हैं पूरी सर
Yeah, go rotate to now. Yes, I learned it.
ऐसा पकड़े ऐसा करो
Wow. Give it the color. Or not.
ऐसे किया
Yes, in our compression recovery.
Huh?
I said this patient as a recipient subsidy source on
the needle was no
I went near the number. Now I touched, I ran to the cord, touched the cord, just pierced the cord very lightly. From the deep destination I gave to the brain. Because the SO signal to the brain. Immediately end of an SO, everything was whatever was. This is called target drug. Why did I say nobody's name? Magnetic will work.
How will you feel?
Like
That's the part of it.
This is the understand many pieces.
Sir, I will do it, sir.
One thing I tell you. Asking me, how to tell you? How do you feel When you kiss your girlfriend.
No, that you should know, Roshan.
Ah.
How can I tell you?
They're not the right person.
Some people need some
At
precautions.
least giving is hearing. At least teachers is hearing.
Well, I'm thinking, how
All
do
our
I feel?
guidance.
I feel the same way as you feel kissing your girlfriend. Touching the cord, going inside, coming, piercing, boom, kiss. Kiss from my dinner. Check. Then it's gone. Before the patient sits on the table, I say 90% is gone.
तेरा माइक्रोफोन नहीं है क्या?
A smile is as beautiful as a beautiful gun. मैं सब आपको भी देख रहा हूँ। ये, sorry, straight up. No, चाचा पापा था। चाचा पापा था। We just चाचा पापा था। पापा दिया, आओ दिया, चाचा दिया। I can't remember. Understand my language.
Code word.
अरे और तो छोड़ो जो माना मरवाड़ी में बोलो तो भी बात सुन अरे मरवाड़ी में बात बोलो जो माना सुना मलयाली है भैया भी सुनना मरवाड़ी
सर,
हाँ
अरे साउंड वेरी लो.
you bring close to me
माइक्रोफोन नहीं है.
now can you hear me
Yes.
so this is a case of spinal muscular
Just. ठीक है सही चल रहा है ये फर्स्ट वाला में टच करना फर्स्ट हाँ आ गया ना वॉइस हो जाएगा चेंज
पानी पिला दो सर को.
क्लोज करें
Where's the camera? Sorry for everything. Give me the sofa. So this is a case of spinal muscular atrophy. You see a typical combination we have made. And now you see how I inject and how his legs and muscles will improve. Give vitamin B12 and Papa. Only B and Papa. Multivitamin or with Papa. First, see evidence. Then convince yourself. Then build your confidence. And then going into training, practice and prove yourself. I was correct. नहीं हुआ इतना जल्दी शादी होता है क्या इतना वेट किया है थोड़ा नेक चार तो करने दो नेक चार का मतलब समझा सर्मनीज बिफोर मैरिज ठीक अब आप पूरा उल्टा सोचो पापा
Ready, Papa?
मैं वेलकम coming or not coming coming and going Now, after 5 minutes, you can see how beautifully he can walk. It's a final muscular atrophy. He can walk. So him walking. How are you getting up? Now you see how much sit like this. Yeah. What is the leg? How much comfortable you are feeling now? Slow it close. His voice is not going. You bring it close. How much comfortable are you feeling?
Very comfortable because I can sit straight.
Now you stretch. Physiotherapist check. What if you run away? See, all the medical doctors will stay. You just always run away. Poor Ganesh. Only eating food. Kaka don't know. Papa doesn't know. Now you see, you like this. Call any physio. Oh, you are? Check. Spinal muscular atrophy. Now check his postures. Movements. Postural movements. Good. How much improvement do you see in a spinal muscular atrophy with just movement? Yesterday he could not do this.
Yeah.
Now he's doing. So now you check and check. And say loudly, people cannot hear you.
Yeah, I'm unable to.
You are remove your cabinet, no one is COVID. Yesterday, what was your position? And now what's your position?
Yeah, it's very good now.
What is
Feeling
the change?
comfortable. Change I can see is I can't fold the hands backside. Now I'm able to fold this backside.
Immediately.
Very comfortable.
These are the immediate changes you're feeling. Now walk. ये तो खाना खाता क्या मैं जान मधु सब तो तैयार
और आवाज बहुत कम है.
so you can see how a spinal muscular atrophy patient has got a significant recovery. You can talk to the physiotherapist. He is a physiotherapist. Ask him question. What he has said, what he has answered. Talk. Talk loudly.
1 second. Walk again. Usually in these conditions, we can't see this much of improvement. Like while walking, now he is able to walk freely. Even though I seen him evening, he's not able to walk like
Walk
this.
loudly. Speak loudly.
Yeah. Even evening also, he is not able to walk like this, but he's walking very easily now.
Yeah.
Close. leave.
Class is going on, right?
Sir is busy for some minute. Please wait.
Avinash, you can put in there. Avinash.
Sir,
सर सर शास्त्री सर
हाँ,
आवाज ठीक कीजिए बहुत कम रहा है।
okay, okay.
speak very loudly. Because fans are there, so voice is not there.
Zoom classes, sir.
Yes.
Ah.
Yes.
And Aditya also is there. Hey, come. Speak.
Hello, everyone.
So,
You can
Dr.
ask me,
Avinash, you can ask him any question you like to ask.
if
You
you
have
have
been
any,
all my patients.
if you have any doubts, I can clarify your doubts regarding search treatment and all the improvement what we see. So you can ask any other questions.
Ask questions. You have
Sir,
only 10 minutes.
actually, see, one area we feel it's lower, like less, like not muscular. At that point of time, we go to the scalp and do some acupuncture technique, and with spinal pen we do. How we will be able to judge that part is this one: how to link it, how to tonify or detonify, like whether we prick anywhere in the brain, like head, scalp, it works in the same way, or whether we have to follow any particular rules.
There are particular areas,
Okay.
specific areas where some part of this muscle or nerve are related.
Okay.
So sir will be the better person to explain the particular areas, where to stimulate.
Okay. So anything like how to stimulate, like anything like any special technique where to stimulate, to
He is
release
not
the
brain
spasticity.
stimulator. He
Stimulus.
is an anti-medicine.
I'm a physician. You can ask me about the physiology of any disease
Okay. So
Whether this treatment is working or not.
and about
Okay.
search treatment.
Okay.
What I see-
Prognosis part.
sure.
prognosis part. Because
You cannot ask him how I treat.
Okay.
He is also trying to learn how I treat.
Sir, I have a question.
about the techniques and all.
Okay.
So once I learn all this, I could be able
So
to
how
answer.
in a case of demyelination,
Mm.
so after doing acupuncture, how the myelination will takes place? What is the process of recovery? How it is going to recover?
Through the activation of nerves. Maybe the myelin sheath would have been recovered, and it leads to innovation. We are buying this EMG NCB. It will be coming in 2 days. We can even demonstrate the reinnervation of nerve. Okay.
So you are telling that body has the potentiality to recover. Only we have to stimulate and
Exactly.
through a proper channel and proper place.
Yes.
Okay.
See, one thing you must understand. What is brain and nerve? What is brain? Define brain in 2 words. I'm asking you a question. Define brain in 2 words.
Father of nervous system.
No, electrical and chemical. What is the language of brain? Electrical language. Chemical is the repulsion of the electrical language. यानी ब्रेन की 2 भाषा है, इलेक्ट्रिकल और केमिकल. अगर आपका इलेक्ट्रिकल सिग्नल सही गया, आपने सही बटन दबाया तो सही लाइट जलेगी. If you press the wrong button, wrong light will go. Same thing what you have asked me. I'll give you an answer. You get it.
Sir, central processor unit.
I'll wait your central processor unit. I'll teach a very simple way. I pull his ear. Will he a pain in the nose? Hey, very good. Where is the pain?
Years only, sir. Years only. Now, nose only.
Now, where?
My God.
Tricep.
Triceps only.
So when I put needle here, if I stimulate here, you'll get here.
Uh.
Did you get pain in the nose?
No, where you pitch, there only pain.
Yeah,
Okay.
that pathway you have to learn.
So how to, we are pricking here, how to release the elasticity, how to tonify, detonify.
See, why do you have to have the brain to make you understand 100 billion neurons work? Your work is what? His work is what? To prescribe antibiotic? Is his work to do research on antibiotic? Are you a scientist or you are a physician? What is your duty? To diagnose and prescribe medicine. Right? Are you supposed to discover medicine?
Not supposed.
You are not supposed to discover medicine. You are putting needles, you are getting reply. Go and enjoy with your wife. No need to make Ramayana out of it.
Okay, sir. We are getting results. So how we are getting results is only the question.
See, whenever you stimulate the brain, whenever we stimulate anything, when he asks me the same question, how do we get the results? Brain is programmed to give you results. But then you must speak to the brain to the language he understands. You want something. I said you, what did you understand?
Please leave it. Vittu vidala. It's in the
You understood?
leave it, leave it.
Leave it.
Leave
I
it,
did
leave it.
not understand anything, right?
Because each and every language has its own meaning, sir.
This is meaningless language I spoke.
But still I got the meaning.
No, I said nothing. I spoke to you, nothing. This is what you speak to them. You speak to the brain, nothing. Why these medicines work? It's generated because the size of the molecules is below 50 Dalton, mixed with glucose, going. What happens? It crosses the blood-brain barrier and it stimulates the brain.
Dextrose, sir.
See, why do we give metazolone with high dilution? 2 ml of metazolone and 8 ml of this one. If you give very slowly, before the 1 ml of metazolone officially is finished, the patient is sedated. Why?
It crosses the blood-brain barrier.
It sedates the brain. Lower the dose, higher the word.
The same concept of homeopathy.
Yes.
Higher the potency, higher the
It
efficiency.
cross the fence, otherwise voice will not go. 4-5 minutes. See, it's when you talk about allopathy, it has its own concept. You cannot integrate allopathic concept to this to this. You may integrate it. When there is an infection, you have to get certain powerful antibiotics that has to be given. This cannot be, this needling cannot subside antibiotics. Atropine cannot subside cardiac. Right? It does not have the potential to immediately what? Because already it is in depression. We need an external dose. Later on, in management level, we can manage it. Similarly, in chronic cases, paralytic cases, spinal muscular atrophy, brain has the capacity and potential to recover. But did you understand this potential? Why? Why you did not study about the neuroanatomy and functional neuroanatomy of the brain? What were you doing so long years?
Okay. Actually, we are not knowing that brain has the potentiality to recover by itself. We thought only medicine can help. That we are not aware of it.
See, this concept is not spoken to me by me right now. Brain stimulation was spoken hundreds of years back, billions of years back. You say Hallelujah. What is the meaning of Hallelujah? No, it's not praise to God. It's a release of oxytocin. This is a vocabulary sound.
Oh, in Christians we tell hallelujah, hallelujah.
Yeah, hallelujah,
Praising the Lord.
hallelujah, praise the Lord,
Yeah,
praise the Lord.
Yes.
Yes. Why do you say hallelujah? Why don't you say gandu, 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 gandu?
Oh, okay. So how you understood, sir, that it releases oxytocin? Any research papers or anything like that?
See, very simple. You go in a very stressed mood, full of adrenaline. Go to a church and say hallelujah, 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 hallelujah. After 2 minutes, you see how much peace is in your mind.
The same way we chant Om, Lam, Vam.
Whatever you say, this has a cosmic sound. This is called by the string theory of Adi Puri Sankaracharya. And that is called in India, Sabda Brahma, Hidad Brahma. The words which you speak creates a vibration in your brain. This vibration is nothing but membrane and action potential. These words also create disease.
Okay.
You injure yourself by spoiling it, by speaking wrong words, by wrong feelings. This is what TCM says. Feeling is very important.
So
If you have wrong feelings, wrong words, wrong understanding, what will happen?
So emotions are very much accomplished for our disease. That's what you are going to tell us, sir.
Every psychological disease is a neurological disease.
Related to the manas. Can we relate it to the manas, sir?
Huh?
Can we relate it emotions to manas?
See, emotions comes from where? No, from perception. What perception you make of it? For example, I always make fun of Avinash, but Avinash never take anything wrong of it. What not I say him? Why? Because he made a perception about me that I'm not a wrong person, I'm just making fun of it. But the same word if I speak to you, what will you do?
How I perceive you, it depends upon that.
Yes.
If I have love towards you, it's come on, Sastri, sir.
It's
No
come
problem.
out.
He will come. No problem.
He will come out. In the same way, it's the brain injury. It's an attack on the brain. You do not understood the CBA or any other thing or muscular atrophy, dystrophy, myelin. It's an attack on the brain. And you are not supporting the attack of the brain. Either you are demyelinating the brain. Because you are not speaking, it's a misunderstanding. And you are doing more misunderstanding.
So without proper understanding of the brain mapping, so if we are not able to correct it.
You don't need to understand brain mapping very, because neuroanatomy, functional anatomy, it will take years to understand. But first ask prognosis of the disease. Whether this disease can be recovered or not, called autoimmune disease, typical spinal cord injury, and all this disease. So that question is close to the MD doctor. You ask him whether this disease, what is his opinion about the disease? You ask him particular question.
Sir, what do you think? The spinal.
Allow Zoom people to talk.
Oh, okay.
Ask question, Zoom. Zoom members ask.
Sir, let me see. 145 members are there
Ask.
watching. Please, you can speaker is there. So you can ask your questions. Participants, it's your turn.
You will ask.
Yeah, please.
So you told that remyelination is possible in a neuron. I agree with that because of the presence of Schwann cells. But in some cases, he was able to recover within 10 minutes or 5 minutes. How it will be possible for an axon or a myelination sheath to recover in a faster manner without giving ample time for getting the injury to recover by itself?
Yeah, I mean, the faster, recovery actually takes time. It may take time. Okay. So usually reinnervation usually takes much time. The sir is stimulating the nerve through brain stimulation. Okay. That's why there is action in the muscle, desired muscle. So maybe the
impulse has to pass through the same pathway also.
Yeah, reinnervation maybe
Even if you stimulate brain, the impulse has to pass through the same nerve which is being stimulated, right?
Yes. So we need to demonstrate the reinnervation actually.
See, I'll answer it because it is not his question. What do you want to stimulate? Quadriceps. How will you stimulate the quadriceps? What is the procedure of stimulating quadriceps?
Stimulating femoral nerve, sir.
How will you stimulate femoral nerve?
By putting an electrical impulse on the nerve root ending.
Is it a correct answer?
No.
On the motor
What
point,
is
sir?
your answer to this question?
Brain stimulation.
Do direct stimulation on femoral nerve is correct procedure? You are also doctor.
Yeah.
Is it a correct answer?
So when it is injured and if we still injure it, that could be a problem. So counterlateral is better. So imaging technique or from the brain, we have to recover the already damaged nerves, and hence that could be a very good idea, I think.
See, you are talking about the recovery of the brain, right? When brain has a potential to recover it, you just try to recover it through the brain. Why you need to go with the nerve? Do you have the imaging system? Are you going to the correct nerve? If you injure the nerve badly, what will happen?
Further paralysis.
Will damage the nerve further.
You will damage the nerve further. It will become nerve palsy. Instead of choosing the easiest way, you want to go with the toughest way. So go with the toughest way. I will not go with the toughest way. You are asking Avinash and me. We are physicians. We always encounter what? Problems of the patient. We don't want to create problems for us also. If we do all these problems, we'll create problem for us. Attendance of the patient will create problem because the pain will aggravate. Situation will deteriorate. But if we stimulate needle from here, we are getting results. There are 250, more than 2 lakh videos. Go and do research if you want to understand this. How it works, when it works, for that you have to study neurophysiology, neuroendocrinology, neurochemistry, neurology, neurosciences, all the branches of neurosciences when you study,
Robotics.
then you will,
Robotics also.
artificial intelligence, neural networks, that is another part. When you want to understand how stimulus is created and how an external stimulus with the pain recovers the target drug delivery, what you call, it comes under what? Neural network.
Only 20% is there.
It's okay. Class will be finished in 5 minutes.
Okay then.
आपको बात को समझना होगा क्या आप डायरेक्ट स्टिमुलेशन देके क्या कर सकते हैं नर्व को अगर डैमेज हो गया आपके पास कोई इमेजिंग है अल्ट्रासाउंड गाइडेड प्रोसीजर है आर यू कॉन्फिडेंट इनफ कि आपने फेमोरल नर्व को डैमेज नहीं किया आपका कौन सा प्रोसीजर से फेमोरल नर्व स्टिमुलेट हो जाएगा ब्रेन पर इसका क्या इम्पैक्ट बनेगा
Sir, actually one question, sir. If we damage or injure a nerve, so there is a regeneration, like I read some article somewhere.
See, question is that what is the immediate impact? How will you have damaged the nerve? What will be the immediate impact on the patient?
One thing, pain might aggravate.
That's the problem.
That's the problem. Yeah. Later on, if it might subside also.
Later you may subside with the painkiller and all, but you have created a panic for yourself.
Of course. So
not only for yourself, but you lost a patient also, and you lost your confidence also.
Of course.
See, medical science is made to go with the safest way. Why do we do sanitization of the skin? Why do we get up so many processes? Why do we clean our hands 10 times, 20 times?
Safety.
To avoid complications. Are we there to invite complication?
No.
No, but yeah. I don't want to become a what? I don't want to invite mosquitoes on my dinner.
Okay. Any more questions? Any participant can ask.
You want to ask questions?
Yes, Ji.
Yeah, Robin, here.
Okay.
So
No.
there is a case of compressive myelopathy with transverse myelitis. Now, it's autoimmune disease, infection, and demyelination. 3 in 1. You will rarely get out of 1 lakh. How much cases do you get 3 in 1?
Very rare, sir.
Huh?
Very rare.
And how much is the recovery?
Almost 0.
My patient has recovered by 60, 70. How much percent did you recover?
Recovery 60%.
What is your comment?
Not possible through modern medicine and allopathy, especially.
Now here is his sister. You may ask question to his sister. She is a professor of dentistry. You may ask whatever you want to ask. Ask quickly.
So how do you feel like is improving?
Yes, he's improving because there are some movements that he can do independently, which he was not able to do previously when we came here, and especially the lower limbs and all the stuff. Right, still there is some amount of deficit, but left this I see some amount of improvement.
Thank you.
How much amount of improvement do you see in this?
Probably around 40%, 40 to 50%. When I came first, then now.
Now, how much you see? Total. From arrival to now.
Around 50 to 60%.
You are right. The patient has improved 60%. Now, how to stimulate this nerve? So you can see how cocktails improve the what?
Sister.
Sister?
Sister.
Dada Papa. Oh. So you can see how we insert stem cells in the patient. कल प्लेट लगवा लें सुबह ना 2-3 दिन के लिए दे देगा ओ मशीन 2-3 दिन
कल डेमो देते ना
डेमो देते 2-3 दिन के लिए रखवा दो 2-3 दिन के लिए ठीक है आफ्टर ट्रीटमेंट बिफोर ट्रीटमेंट रात को आके आप ग्राफ चेक कर आपको भी एमजी एनसी तो आता ही हो तो we are getting EMG machine tomorrow after brain stimulation we'll do EMG to scientifically see we have an orthopedic doctor you can ask him question he's a senior orthopedic surgeon with 23 years of experience ask him question is a case of non-compressive myelopathy transverse myelitis and multiple sclerosis. Is 60% improvement possible in this patient, sir?
No, with conventional treatment, no, but with Dr. Sastri's treatment, yes.
Okay. You may ask other questions. Please, you may ask, is a very senior orthopedic joint replacement surgeon.
Participants, you can ask your question.
Your doctor?
Dr. Mihir, no.
You can see in his Facebook. He has done more than 3,000.
Hip and knee replacements.
He has done more than 3,000 hip and knee replacement. And now he has stopped doing the replacement and he has entered integrative medicine. You may ask him questions.
So really you have stopped?
Yes. Totally stopped.
That's
In
really
last,
amazing.
1.5 years.
Yeah.
And I'm into integrative medicine.
Oh.
Biology really. Because see, people don't want to go under the knife. People if, are going under the knife involuntarily because they don't have any other option. If we can give them a viable option and cure them of their pathology, people will stop getting operated.
Of course, you're right, sir. Absolutely right.
And with such kind of new treatments coming up now, I can surely say that hip and knee replacement are going to be obsolete in the next 5 years.
Great. Thank you.
Ask more questions. Sir, give some small lectures. You may ask your question to the orthopedic surgeon, please.
Sir, you can ask directly.
Sir,
Yeah.
if you go for any invasive procedures, what is
Okay.
what's your result, percentage of result or recovery?
Yeah, he's asking if you go for invasive, like,
Procedure. Invasive procedures,
Yeah, invasive.
Even if you
particular
go
case.
if you go in for an invasive procedure, the rate of recovery depends upon your surgeon. If you operate properly, then rate of recovery is good. But once you get operated, there's no recovery. Because putting an implant on knee causes the bone to get permanently damaged. There's bone loss. What do we call as stress shearing of the bone. So even if what you call as successful is actually leading to a bone loss in the patient. So every 5, 6, 7 years now, the patient has to get reoperated to replace the plastic insert. So there is no such thing. Once you get operated now, there is no such thing as successful. Remember that.
Okay.
Okay, sir. It depends on not the procedure, and it depends on the surgeon.
It
Okay.
depends. What I said, even if the operation is successful, your knee, the lower end of femur and upper end of tibia, if there is bone loss, continuous bone loss. Till the implant is there because stress shielding. There is the mechanical forces cannot be transmitted because of the implant. So even if the procedure is successful, you are losing your bone and there's a severe bone loss. And when you go in for a revision procedure, then you will be shocked to see in 6, 7 years the bone is totally destroyed.
Sir, in case of vascular degeneration of neck of the femur, so at that case, yeah, at that case, are you confident with?
Yes.
Yeah.
See, AVNF is not to be operated unless it is grade 3B.
Okay.
Unless until the femoral head has collapsed totally, no surgery. And even the femoral head has collapsed, then also you can do excision arthroplasty. You can remove the damage and that's it. Then leave it as it is. So patient gets quite comfortable. There's no pain. And there's no implant also.
Okay. Then
only
how
there is slight shortening is there. The patient might face a slight shortening.
he will be able to walk, sir?
Of course, he will be able to run.
Oh, fine, good.
Of course, he can run.
So just removing that, how it will be able to fit into that groove, sir, acetabulum, if you're shortening the like.
So then it doesn't fit into the acet. Once the head is removed, there is no question of the femur neck fitting into the acetabulum.
Then
we leave it as it is outside.
Then you connect it with some.
It is not an excision arthroplasty.
Okay.
We don't connect anywhere. We just cut it and leave it as it is, and then suture the wound. So patient, because the hip muscles which are attached to the greater trochanter,
okay,
patient can walk with a slight shortening. Otherwise, patient is okay.
Okay.
And see, any implant inside the body causes metallosis.
Metallosis means?
Once you implanted total knee replacement implant or hip replacement implant, it causes metallosis, covert chromium metallosis inside the blood. The metal spreads out inside your body.
So what will be the effects, sir? Long-term effects?
Long-term effects are, it is known to cause, the metal is known to cause cancer because it is irradiated metal.
Okay.
So it is known to cause cancer in rare cases. And the human body is not made up to have metal inside the body.
Okay, fine.
First, when alternative approaches are available and they are 100% successful, I don't want to put unnecessary metal inside your body.
Exactly, sir. Perfect.
Huh?
Yes, sir. Any more questions you can ask?
No,
The teeth filling, huh?
Teeth is so small. Teeth filling is so small.
But still it will be effective.
But these implants are so big and heavy.
Yes, of course, sir. So any more questions you can ask?
Ask question from Philippines, Malaysia.
From
orthopedic surgeon is there.
From Philippines, Malaysia, participant students can ask any more question.
Because all the time you say, but the doctors do not believe in acupuncture, they don't believe in this, they don't believe in this. Now you ask him the question, doctor is there, 23 years experience, doctor is here. You may ask him whatever you want to ask.
Yes.
Excuse me, sir.
Yes.
Sir,
Introduce yourself.
if there is a surgery, operated surgery, and if the screws are left inside the leg, so what will be the later effects?
In case of operative surgery, the screw is left inside a bone. It doesn't cause any other effect. In fact, the bone, after say period of 1.5 years, the bone covers the entire screw and is left inside the bone. There's no other side effect.
Okay.
It doesn't matter, sir.
See, because the screw is not a weight-bearing implant.
Okay.
No, it doesn't cause metallosis. Whereas hip and knee replacement, they have weight-bearing implants. So because of the continuous wear and tear, it causes metallosis inside the body and stress shielding. The main side effects of this, which no surgeon is going to tell you.
Plate
Okay.
and screw is okay, I see.
Plate and screw is okay.
Okay. Okay. Thank you, sir.
So, excuse me. Good evening,
Yeah,
sir.
yeah.
In this same context, I am having one question, and and that is, if after few years, if the patient is getting pain in the same leg, so what is the consequences of it?
So
What is the question?
please clarify, like after operating
What is
or
the question? Pain where?
Pain in the same operated leg, sir.
No,
So at the
but operated for what?
At the site of screw, sir.
Knee replacement. The patient is operated for?
knee replacement or hip replacement, if we get the same pain in the
again.
same leg after
See, the
operating.
pain could be now because of various factors like malunited, malpositioned implant. Then the muscle, what we call as, we have to have a exact rectangle by taking the cuts and release of muscles. So if the exact rectangle is not there, then there can be a medial tightness. Pain could be because of that. Pain could be because of loosening. Pain could be because of infection. Pain could be because of artificial fractures in the bones. There are many reasons.
Nerve compression.
No, not
Nerve damage,
compression,
like
no.
while you operate it.
No, compression.
No, nothing.
Yeah, all these complications. Infection is the main.
Hi, good evening, sir.
Good
Yeah.
evening.
I have a question to you, sir.
Yes,
I am Iqbal from India.
welcome.
It's my privilege that I am talking to a senior surgeon.
Yeah, tell your question, sir.
My question is very silly question, that after coming here and learning the NBIs, non-invasive brain stimulations, you will give it back and do the same procedure in your clinic or in hospital, or
Yes,
you
of course.
again?
That is why I'm here, na?
Okay.
I'm not here on
Okay,
picnic.
then you will not do any surgery or
I'm already know. See, I'm operating trauma and other minor cases, cold cases, but these kind of knee arthritis, spine and all, na, I've given up completely because I got 100% strike rate, 100% recovery in my patients.
That's nice. That's nice.
Yes, sir.
Thank you.
Nice, sir. Very nice, sir. Nice
Hi.
to hear that, sir. Thank you.
Okay, any other questions? Sir, along
Sir,
with
this
that,
is
any
Vandana.
other subsequent treatment that you use along with acupuncture? Anything?
See, I am using orthopedic laser therapy, photobiomodulation. Then I'm using prolotherapy and ozone therapy. Then I'm using gated injection, sodium channel blocker for spine. Then I'm using neurostimulation. And now I'm using NIBS with neuroacupuncture.
Okay, sir. Thank you, sir. Any more questions you would like? You can ask.
Hello, sir.
Yeah.
Yeah, I'd like to know what type of laser are you using?
What?
What are the laser
I'm
treatment?
using a photobiomodulation, orthopedic laser.
Which one?
Orthopedic laser, cold laser therapy, cold laser, K-wave cold laser therapy.
Class 4, yeah.
Yes.
He's a laser expert from Singapore.
Oh, okay.
Yeah. He's my student. We are very good friends.
Acha?
All the Zoom class, only they sponsored it.
Huh?
This Zoom class was sponsored by Singaporean.
He's the laser expert in Singapore. Means what laser expert?
And he's in the TCM board of Singapore.
Oh, okay. What laser
laser
expert is that? Laser therapy?
Are you asking? Nobody, he wants to speak to you.
What kind of lasers you are using in Singapore?
Well, I use photobiomodulation.
For joint or for skin?
Yeah, for joint, and also I apply it NIBS.
Oh, okay.
Yeah,
Great.
I also treat diabetes. For diabetes as well.
What is your name? I forgot.
Can you hear me?
Huh?
Rodney.
Yes, sir.
Rodney?
Yes.
Rodney what?
Rodney, we call him Rodney only.
Rodney, okay.
Rodney Lim.
Rodney Lim, oh, okay, nice to meet you. Rodney, you should I will stay in touch with you for laser procedures.
Sorry, I can't hear you clearly.
Rodney, I will stay in touch with you for laser procedures.
Oh, no, I'm not doing surgical. I'm doing therapy.
No, not. I'm also not doing surgical. I'm talking about photobiomodulation.
Yes, yes. So,
Yeah.
I mean, what class of laser are you using?
I'm using K-wave laser.
Sorry?
K-wave, cold laser.
Oh, I see. Okay, I'm using the class 3B.
Okay.
Yeah, full range of class 3B. And also with sublingual.
Oh, okay.
Yeah, and one of my specialty is addiction.
Oh, okay.
Yeah.
Nice to know you, Rodney. I'll stay in touch with you.
Yeah, sure. Okay, we keep in touch. Thank you, sir.
Okay, sir. Thank you, sir. Thank you so much.
More questions, please.
Any more questions you can ask?
Whom you want to ask? They are all doctors, orthopedic, Ayurvedic doctor. Whom you want to ask?
Okay, G.
G.
Yeah, I want to know because the last young patient that you did, I saw he's walking a bit limping.
One minute.
Last patient, he wants to know what was the case. Just before we have done one case. Sir's case,
Yes,
yeah.
before this one, the previous one.
See, that patient has already recovered 60%. Well, now if you see, he has recovered by more than 20 to 30%. And
sir, what was the case?
It was a case of compressive myelopathy, non-compressive myelopathy, transverse myelitis. There is total demyelination of the nerve.
He's here.
Yeah, he's the one.
Is it due to genetic or acquired?
I cannot say it is genetic or what, for what reason it is.
That could not be genetic because quite recently original.
15 years he has been suffering.
15 years.
How it has been originated, I don't do that research. I had to recover the patient. So I started doing research on his recovery rather than doing the research on his disease.
Yes.
See, I am one person. You put 150 patients here. What will I do? In Zoom class, Zoom presentation.
Understand.
You want to kill me or what?
Yeah. You're
Oh,
really doing a
what do you want
wonderful
to kill
job.
me? I mean,
Gee, you are Superman.
taking seminar, teaching patient, explaining. One that orthopedic doctor, one BMS, one physiotherapist, one BHMS, one senior orthopedic surgeon, one cardiac anesthesiologist, one medicine doctor. You understand how I face all these people at a time.
Right. Well
And then the
done.
neurosurgeon interprets in between. But I'm lucky that all these people have examined the patient. They are satisfied with the results. And so they don't put questions, but then they come with their own procedures to help my patient. And I also learn new things from them. And that is the reason. Every day I come on the Zoom class to learn new things. And that is the reason I organize seminars, because I get integrated with such good, great physicians. And they help us to learn new things.
Sir, if anyone would like to come with you to learn PRP, will you be able to open up to them to learn PRP, prolozone?
All this is significant right now.
Yes.
Yes, sir.
Singapore or Mumbai?
Sir, to your place.
I am thinking about to Rodney's place.
No. Like I'm asking, like for anyone.
Come. No problem.
Okay.
Yeah, you can come.
So I'll be coming to you.
Yeah, come.
Sure.
PRP.
When you come,
It's the easiest thing.
कल मशीन वाले ने सिखा देंगे ना
ये सिखा देंगे मशीन की जरूरत क्या PRP वैसे सीख जाते हो PRP is nothing great.
Rodney को ask Rodney whether we can come Singapore trip सर को भी लेके जाएंगे Singapore.
I always go to Malaysia in Johor Bahru.
Rodney
comes. Rodney always comes. Rodney is my very good friend.
Rodney Singapore.
No. We don't need to go to Singapore. This is Johor Bahru.
I know Johor Bahru.
So I have a seminar in Johor Bahru. Always I have to go monthly to Johor Bahru. So Ronnie is my best friend. He comes there.
From Singapore.
Yeah. So talking to Ronnie is very easy. Very nice man. Down to earth. and my financer also of Zoom class. Amadi and Roni always saved me from this Zoom financial loan. If this Zoom class is running, I should thank Malaysians, I should thank Singaporeans because they took the initiative. Amadi is a constructive worker, the president of a company, but he practices excellent acupuncture.
Where?
In Singapore.
In Singapore only?
Yeah.
Ahmadi what?
I only know him as Amadi.
Ahmadi.
And if you see the cases he is taking, even a neurologist or neurosurgeon will not take.
Jaan Singapore. Ahmadi or Rodney will begin.
I want to thank you for your fine
wants to
teaching.
come to Singapore to meet you.
To see the cases.
Welcome. Come. To
Thank you.
Singapore.
So more questions, I say I am more patient. I think we can close the class. You also enjoy, I also enjoy with the patient. We have answered enough question, answer, infinite answer, infinite questions. If you want to learn about brain stimulation, if you want to learn more about acupuncture, go to the revision class. If you want to learn medical topics, even in fellowship class.
Gee, when you start the revision class?
First let me complete my seminar. You want to kill me or what, Roni? Already I'm overloaded. When I will die?
Don't.
I'm already overloaded.
Okay.
Let me find some time.
Okay.
Okay, sir. Thank you, everyone.
Thanks a lot, sir. Thank you.
Thank you very much. Okay, have a good day. Bye.
Thank you.
Okay, bye.
Thank you, sir.
Sir, leave meeting, no? Leave meeting.
Okay, bye.
Good night.
Thank you.
Thank you, sir. Thank you, Mr. Lee.
Thank you. Thank you, everyone. I'm
Good
shutting
night.
down. Good night.
Good night. Good night.